Hello, everyone. My name is Allison Collins, and I am the digital engagement editor here at the Chattanooga Times-Free Press. I'm really excited we can be hosting this panel. As you all know, it has been a very crazy past 6 months. I guess we're coming up on the 6-month mark of our first case here in Hamilton County. And we wanted to host a panel just to talk about where our community is at now, where it's been, what we can see in the future as far as the COVID-19 response in our community. And arguably, we have three of some of the most critical people in that response here today. And our full-time healthcare reporter, Elizabeth Fite, will be moderating and asking the questions today. And just a quick shout out to Elizabeth Fite. She has been covering this since February, and she's been covering pretty much nothing but the coronavirus. So she also knows a lot about this topic and can hopefully shed some insight into how we've been covering it as well. Just a few housekeeping things before we get started and before I turn it over to Elizabeth. As kind of in collaboration with Champions of Healthcare, we are launching a new healthcare email newsletter that will go out weekly called the Weekly Checkup. You can subscribe to it at timesfreepress.com/newsletters. And we are also starting a new Facebook group just so we can share all of our healthcare related news from Elizabeth and other reporters. We've had several reporters covering healthcare now, which is a little unusual for our newsroom, but they've jumped in. And we can share their stories in that healthcare Facebook group. So go to facebook.com/timesfreepress to see the information on that group. But other than that, I am going to bow out, and Elizabeth, I will turn it over to you. Thanks.
Thanks, Allison. So like she said, I'm Elizabeth, and we're here today with some of our most important leaders in our local COVID response. First, we have Ray Bond from the Chattanooga Hamilton County Medical Society. She is the CEO there. We've got Dr. Andrea Willis of Blue Cross Blue Shield of Tennessee, and Dr. Kelly Arnold, the founder of Clinica Medicos. So I'm gonna go ahead and get right to our first question, which is going to be, everyone, tell us a little bit about your role, the role of your organization, and how it's been responding to the pandemic. What's your primary focus? Let's start with Dr. Arnold.
So a little bit about myself, I guess, to begin. I am the founder and director of Clinica Medicos, and I do that primarily on the medical front of things. And then on the community front, I'm involved with the mayor's task force and sit on the boards of La Paz, the Medical Society, in addition to the Community Foundation's Chattanooga Resilience Fund. And so all of those points and roles have intersected along this course over the past 6 months. Thank you, Elizabeth, for all you've done to report over this. I do appreciate it. But as the director of Clinica Medicos, really our role in this began early on, early spring, in which we realized that there was going to have to be a path carved out in reaching the Latinx community, especially vulnerable people who were underserved, uninsured, unattached, in creating a pathway of equitable, accessible testing that also involved education. And that then evolved over time into the wraparound services needed based on how we saw our patients weathering either the illness or the results of the test. And so that then evolved into, what do we need to do for the patient regarding financial needs, housing assistance, food services, and even further, advocacy inside of employment structures. So we've touched on a wide array of some of the challenges we've seen inside of this pandemic.
Thank you. So next, let's hear from Dr. Andrea Willis of Blue Cross Blue Shield of Tennessee. How have you and your organization been responding to the pandemic?
Well, first of all, thank you for having me be a part of this conversation. So I serve as Chief Medical Officer for Blue Cross Blue Shield of Tennessee. I oversee the medical management areas, but for the most part, I was the clinical support and liaison for our broader Blue Cross leadership, because collectively we saw our role as a part of public health. And so the type of things that we did is we created a social vulnerability index. So we did that so we could be more proactive in our outreach to our members that were high risk for COVID infection. We collaborated with the provider community to make sure telehealth and telemedicine could be expanded so that there was the availability of more virtual care. Our foundation funded free testing for the uninsured and underinsured. That was another thing that we did. And we just really overall felt like we needed to take this moment so that our mission came to life. Our mission is peace of mind through better health. And so we just wanted to be that for our members and for the community as well.
Thank you. So Ray Bond, I know you've had a lot of different roles in this response. Tell me a little bit about what the Medical Society has done and then how that kind of has connected a lot of these dots.
Sure. Well, initially, the Medical Society is a 1,000-member physician membership organization, and we have a couple of goals. We work on behalf of physicians, but we also advocate for community health. And so within the Medical Society, we've been trying to convey the most recent and current information and changes of practice changes and things to help support medical practices as they try to determine how to respond to COVID. But when I was asked to help lead the COVID task force, the Medical Society also gave their blessing and sort of dispatched me to work with the city and county as we tried to craft a community-wide response, which has taken a fair amount of time. The COVID task force was created by Mayor Jim Coppinger and Mayor Andy Burke to initially provide them advice and guidance on the health-related issues around COVID as they made policy determinations. But it quickly morphed into really trying to stimulate community partnerships to dramatically increase and enhance the availability of testing throughout the community, working on messaging to reach some of the communities that were most disproportionately impacted by COVID initially. And so, and then also starting to look at data collection and what information did we have, what information did we need, and how would we best present that to the public. So the COVID task force's role has sort of emerged over time. And it's been a really great community collaboration. And I've just been trying to help facilitate and coordinate communication and coordinate some of those efforts.
Yeah, it's been great to see all these different entities coming together and working together. So I'm glad y'all are able to do that. So now we're 6 months into the response. We've made a lot of progress. We've learned a lot, but there's still really no clear end in sight to this pandemic. So maybe let's start with Dr. Willis. What are the next big hurdles for us as a community and for your organization?
So you're right. I mean, you know, we definitely made a lot of progress quickly, but I think that also helps us to see pretty quickly too, lessons learned. And that's a good thing. For example, you know, with the expansion of telehealth, telemedicine, then we saw the importance of broadband access. So that was important not only for virtual care, but that's important for education as well, which is an important social determinant of health. So I think that's the other thing that really came into focus in even a more prominent way. So it was not only this pandemic, but it was also the racial injustice issues that are out there looming. And that just really showed that there are populations that we really need to turn focus on. Those people are facing challenges every day. And while it can seem like a challenge to the healthcare system to address those, I think we really need to look at it as being an opportunity of how we address those things. Because if we can do for the people that are impacted the most, then it really serves all of us well.
Awesome. So Ray, to you then on that same question, you know, progress, but also, you know, what are some of the next hurdles you see coming down the line?
Wow, that's a really good question, Elizabeth. You're famous for those. I think the biggest challenge really is that until we have a vaccination that's been widely implemented and widely accepted, we're going to have to continue to deal with COVID. And I think everybody has a little bit of COVID fatigue. People are not as excited about the masking and hand washing and, all of the things that help us. People we're sociable creatures. Most people have had a long period of isolation. So I think the hardest thing is to help us as a community continue doing the things that we know work: wearing masks, social distancing, hand washing, those basic practices. And in some ways it seems almost too simple that that's the answer for our community until a more permanent solution is found. So I think that's going to be a really big challenge. I think that it's also challenging because while viruses don't have political affiliation, I think it's become somewhat of a political issue. And so we need to constantly try to find neutral and positive messaging to help people understand that we as a community can continue to come together. We can do things to help the economy restart, to let people maintain their livelihoods. But it's going to mean that until we have more permanent solutions, we need to continue to do some very basic stuff that gets really kind of tiring over time.
And I think we'll segue right to Dr. Arnold, same kind of thing. And is there any other hurdles or things down the line that we haven't discussed that you see?
Yeah, I kind of blend upcoming into ongoing. There's that bucket, and then there are those that are truly upcoming. The ongoing and upcoming category falls inside of a need for unified national messaging that blends with the evolving scientific data that we have in a way that's translatable to the public. And that translatability rests largely inside of a lot of healthcare literacy challenges we have in this nation. And I think that we really hit that head on, almost as head on as we were hit with computer literacy in an era in which, whether that was telemedicine or whether that was now instructing your children, that is a huge, huge burden and upcoming hurdle for us to face in the whole rest of the year. As a physician, I look at the hurdles of the availability and affordability of PPE, the availability and affordability for community physicians to have rapid point-of-care testing that is accessible, that is highly sensitive, that is easily interpretable. To what Ray was saying, how do we balance public health with a thriving economy and school system that those coexist? And then lastly, I'd say probably in the unknown category of upcoming is what are we truly facing with the febrile viral entities of the winter, and how our community physicians, not just hospitals, but how our community physicians going to wrap their arms in a healing nature around the reality that sick patients need to be seen. And telemedicine oftentimes doesn't cut it, and a testing site doesn't cut it. And so how are we really going to implement this model of face-to-face safety, compassion, and adequate medical care?
Awesome, thank you. And I know everyone at the TFP can relate to that, trying to get the message to the people, and we can always, try to find better ways to communicate these important public health messages. So thanks for y'all's help doing that this whole time. So what are some of the, and we've touched on these a little bit, so not to be redundant, we don't have to spend too much time on any of these, but some of the most important lessons we've learned, and we'll carry those forward as we continue to navigate these challenges. I mean, can y'all think of anything that we haven't touched on? I'll just kind of open the floor on this one.
Well, I'll say some things generally. I think, we've learned that you have to react early. That's one of the things. You have to be nimble. I think, when some things work, we're kind of feeling our way through this, but when we find something that works and that is truly making a difference to some people, to go ahead and implement those things, you can always make them better over time, but not to delay what could be of service to people. So those are kind of general things, general themes I think that we've learned through this.
I think we've also learned, to me, it's been a demonstration of the power of partnerships. And it's been really exciting and encouraging to see the agencies that may not have collaborated previously coming together to address quickly some real needs, the wonderful willingness to share best practices, to share resources. A lot of what might traditionally be competitive lines between medical practices or between hospitals have all been sort of set aside. The hospitals have worked very collaboratively to share information and resources and best practices, and medical practices have done that too. And I think the other thing that's been really encouraging is to see a lot of different entities really looking at the issue of health disparities and how do we need to communicate messages and how do we need to address health disparities within different communities. And so it gives me a lot of hope that when we get to the other side of this, we'll have learned some things and established some relationships that can help us dig very deeply into that whole issue of health disparities and how we work to improve the health of everybody in the community.
I didn't know if you had anything to add, Dr. Arnold. No pressure there. I just,
question of maybe will you repeat the question? Were we on the misperception?
Lessons learned that will carry forward.
Okay. I'm sorry. I went into another question in my head. I think that, aside from what Ray and Dr. Willis were both saying, I've been enamored with the pace at which we can accomplish things when we focus. And so never in my career have I seen scientific endeavors, whether they're named warp speed or not, happen with such concentrated fervor and support from so many sectors to try to solve a problem inside of an illness, inside of a community population. So I think the lesson learned is that, when something else arises, we know what the potential is inside of healthcare system, free market forces to solve it. And so I think that's kind of what I take away from that. And then I do think that when the territorialism has been shed, the ingenuity, the collaboration, the partnerships that go to the greater good are incredible. And that has been done over and over inside of Chattanooga. And I couldn't be prouder of that. And I hope it carries forward.
Yeah, that is
one of the,
no, go ahead, Ray.
No, well, one other area that I just want to acknowledge too, we sort of had to warp speed the adoption and implementation of telehealth to deal with the very early challenges that medical practices were facing. And I think that has, I'm first impressed with the speed at which everybody was able to adapt. I'm pleased with the regulatory changes that were made, and I salute Blue Cross for the rapid deployment they had of telehealth. So I think that over the long term, that's going to really, as we face the next health issue and the next health issue, I think that's going to make it much easier for us to provide care to people in rural areas and people in underserved areas within our community. And also, it's been really extraordinary to watch the way the community responded to make internet service more widely available to many more people. And so those are all things that, we came together in a crisis, and I think we've done as well or better than we could have expected, but those are things that are going to move us forward in the next step as we figure out how to continue to improve community health. And that's really encouraging to me.
I do have one other thing to add, if that's okay, Elizabeth.
Oh yeah, of course.
About it. I also think that we'll focus more on, probably in retrospect, what near paralysis of our healthcare system did on a large scale and inside of the big picture. And by that, I mean, while we became laser focused on one public health issue, unfortunately, over some months, others were forsaken that we had made large strides in, whether that's diagnosing cardiovascular disease, whether that's vaccinating children, whether those are sophisticated chemotherapy regimens for patients. And just those ongoing medical needs, I would hope that next time in light of a crisis, there's less paralysis about those general healthcare needs that still exist and are as important.
I'm glad you mentioned that, because as a healthcare reporter, I think about the stories that I would be writing a year ago that were so important and are still really important today. And there's going to be no shortage of those going forward.
Right. Right.
So segueing to the next, and I'll start with Dr. Arnold on this one since she was already kind of there. What are some of the unmet needs in this fight that, you know, we're going to need to kind of fill gaps going forward?
Unmet needs, I mean, this goes back to unified messaging. I think that there is an unmet need right now to psychologically reassure people about what the overall plan is, what the future looks like. I think that people really want to rest inside of some sort of confidence, and for one reason or another, we became splintered for many geopolitical reasons that put us back a bit, you know, in that psychological need we'd like to meet and going forward. I would also say that still the wraparound services for people who either suffer the mortality of their families of this illness, or experience the ramifications of a lost job. You know, those social wraparound services in many parts of the country are largely unmet. And on top of that, there are stories now evolving that on the backside of this illness, so whether you're uninsured, you're undocumented, the ongoing medical needs, the ongoing medical condition, the equipment one might have a need for, where are those gaps being filled in for people who have survived this, but survival doesn't necessarily mean now a clear path? How are we helping them on the back end of COVID-19? So I think that principally those are the ones that I think about.
Dr. Willis, do you have any thoughts on those unmet needs and things we might need to be kind of working towards?
So we've touched on some of the things already. I mean, testing certainly has been a challenge in different ways over the course of time. But I mean, certainly we saw the importance of it, and we saw what we didn't have at our fingertips when we needed it. So the actual tests themselves and testing supplies and things of that nature. I do want to take this moment to applaud the people that have been valiant in the testing effort, though. Definitely Tennessee would have been in a much different spot if we didn't have people really fighting hard for that. So I do want to thank them. I want to thank the frontline workers that did what they did. So I do want to just say that in the midst of this answer. But I think, though, we actually have an inventory of what we need going forward, and we'll still find some things as we continue to go on. But also, as Dr. Arnold was mentioning, I think, again, the social determinants of health come up here. So, I mean, it's not only the deficits that some of those that we serve have, but it is how are we going to address those deficits, and what deficits has it shown that exist in the healthcare system today. So it is the healthcare system that people need to turn to for, you know, the COVID infections and other things as well. But if that trust is not instilled there, will they turn to that system, and will they continue to walk with that system so that they're in the best health that they can be? And what can we do in our communities to make sure that we're shoring up needs there? So I just hope we don't let our foot off the gas on those things.
Ray, I didn't know if you had any thoughts too, just on the task force, and this is a big part of what y'all do, is try to fill gaps and meet needs.
Well, as we get ready to enter flu season, a lot of our community partners are waiting to see about funding resources that are going to be available sort of for the next round of testing. We sort of had a season of really good funding, so the next step is going to be seeing what funding is going to be available to continue to stand up testing sites and continue to make testing widely available. So I think that's going to be a really important thing. And I'm sorry, I have a dog barking in the background. That's going to be really, really important going forward. So we just want to continue to build on the partnerships and collaboration that have already been established.
Yeah, that's one of the silver lines of all this these Zoom meetings is getting to meet everyone's pets. So well, you never have to apologize for the dogs around here. So I did skip ahead over a question, so I apologize if I threw y'all off, but I do want to touch on this before kind of moving to our final questions. What are some of the biggest misconceptions about COVID that you would like to dispel? And I mean, this can be either public misconceptions among other healthcare providers, or even in the media that you just feel like now's your chance. So we can start with, let's start with Ray this time, and then we'll go down the line.
I think one of the misconceptions, I think that many people think that younger people don't need to worry about getting COVID because they aren't badly impacted. And one of the things that I think, and again, I am actually not a medical professional. I work for the medical professional. So no, I know Dr. Willis and Dr. Arnold will correct me if needed. But we're starting to see there's a potential for some long-term physiological impacts that people have, even younger people, from COVID. We don't really understand long-term how this virus is going to impact folks. So the bottom line is there's a misconception that if you're not older and if you don't have underlying health conditions, you don't need to worry too much about it. It's just kind of like a bad cold. And for some people, it probably will be, but for other people, there's the potential for a real long-term impact. And so, without terrifying people so they stop wanting to do anything, we need to help people understand this is real. It's concerning, and essentially we didn't know anything about this a few months ago. We didn't know it existed a few months ago. And so there's still a huge learning curve, and the science is changing all the time. And I think also, I think it's hard for the general public to understand how the best advice will change over time. And simply because this virus is so new, the recommendations and the protocols are going to change, are going to evolve as more information becomes available and as we understand what works at best and what doesn't work maybe at all. So helping the public have a better understanding of why the advice might change from 1 month to the next month, or even from 1 week to the next week. I don't want people to not respect and not trust the science, but the nature of science is it's a process of discovery, and we're still just discovering how this virus acts and what it impacts and how we can treat it. So to me, that's a really big issue. I want people to have confidence in public institutions and understand that everybody's doing the very best that they can, but it's very much an evolutionary process.
Yeah, and Dr. Willis, I didn't know, we'll go to you next. Just misconceptions, things you wish people understood about this virus.
Well, I think for me, one of the big things is for people to understand that it's not just a personal decision how you deal with this. Like, if I want to wear a mask, then that's up to me. It's really about public health. So what we do not only impacts us, but it impacts our family, our friends, our community at large. It really is about us doing everything that we can do to protect each other. That's the biggest thing that I see, is a lot of times people personalize it, and this is a community threat.
Dr. Arnold, what about you? Do you have any thoughts in this realm?
Well, it touches on some of the things that both Dr. Willis and Ray have just mentioned. And I think that people look at science as something that's concrete, but science is humble, it's nimble, it's malleable, and the scientific method involves exploration, and we're along that path. And so just because things are in that supple form doesn't mean they shouldn't be trusted, because it might just be in that moment and then we move on to the next better thing. So I think along that path, we've seen this duality inside of these misperceptions, in which on the one hand, being too cavalier about this because the people haven't gotten really sick, and so it's not that bad. Well, that's not true. And on the other hand, having so much fear that you think that by contracting this, it's an automatic, escalator to morbidity and mortality. Well, that's not necessarily true too if you're not vulnerable, don't have underlying comorbidity. So I think operating in that gray zone is where we need to be. And the misperceptions really lie in those people who have to live in either a red or green, black or white scale inside this.
Right, yeah, it kind of takes us back to our 9th grade biology classes where they're having to tell us, very few things in science are laws, right? So we'll just keep looking for the evolution of the science here. So, we touched on the flu season coming up and some of the other responses. Do y'all feel like this will make the crisis more complex? I know some of this is predictions, but I kind of think a lot of people have that on their mind, right? This is already, we're heading into fall. Flu season's upon us almost. So can y'all share any insights into things people should know about that? We can start with Dr. Willis.
Well, I definitely think that the flu season can complicate this whole picture. So not only are we looking at two illnesses being very prevalent at the same time, we have to look at the healthcare resources that are available. There are just so many available hospital beds, for example. So that's something that we have to think about. We believe that we really need to be proactive in encouraging people to get flu vaccinations. Our foundation is making a very sizable resource donation to actually promote flu vaccines. So in the next few weeks, you'll see that we're really out there trying to promote. We are concerned about it and we want people to be proactive.
Dr. Arnold, do you have any thoughts on the coming flu season and how that might intersect with COVID?
Well, I think a large challenge for physicians, healthcare providers is going to be the educational platform they're going to have to be extremely active about towards their patients, in that there are a myriad of illnesses that can befall especially children during the winter season, and some of those will be completely normal and some of those are necessary in building a healthy immune system, right? And so I think the education from the beginning in that there are some things that we are anticipating and there are some things that we know. The complexity, I think, is going to come in, again, this need to shift into another season that has an unforeseen story inside of it. In the same way, during the spring, some of us were misled by thinking there would be a seasonality to this, but we were completely wrong when the virus took a left turn come summer. And those same things might happen again in the winter. So at the moment we think that we're prepared, this might take a left turn again in a way that we didn't anticipate, and that's going to be highly complex. So I do think that there's the knowledge of knowing what's going on with the patient, and then there's going to be complexity of, well, not all febrile illnesses will just need a SARS-CoV-2 test. Who has the access to rapid flu, rapid RSV, SARS-CoV-2 all at the same time, and then the confidence to say, well, there are also other coronaviruses circulating inside of the winter too. And so I think it's going to, as a physician, bear a lot of complexity inside of how confident patients are in receiving not only the education, but the assurance and the diagnoses that you're giving at the time, knowing that there's still this element of the unknown.
Yeah, that's a lot to think about. So Ray, I don't know if you had anything to add on the coming flu season.
Well, we want to encourage people to get flu shots. And at the same time, I just always am trying to encourage people to continue to attend to their ongoing medical needs. If you need to see your cardiologist, you need to see your cardiologist. If you're past due for a physical, you need to try to get your physical done. Because at the same time that we're trying to address COVID, we can also have very negative impacts if people delay needed medical care. And I think the hospitals and medical practices have really worked overtime to create a safe environment for people to get medical care. So we really just want to encourage people to go back and see their doctor, to go back and get the routine tests they need to have done, because delaying care can also have very negative impacts. And I think I said it, but I'll say it again, get your flu shot.
Flu shot's key. I've gotten mine every year since I've been a healthcare reporter, so I speak highly of it. Just to wrap things up, I wanted to talk on some kind of bright spots or just positive notes about the process that we've been through over the past 6 months. And I know y'all have hit on those, so I'll kind of also just open the floor. If there's anything you feel like we haven't touched that you wish people knew, now's the time. I really appreciate y'all taking time to share your insights. It's great to kind of hear it all summarized in this format. So let's start with Dr. Willis and just kind of share, is there anything good we can point to that has come out of this crisis?
Absolutely. Again, we talked about telemedicine expansion, and that's important for a few reasons. That it improved access, but it also showed us that when we work together, that we can move things along rapidly. So I think that's great. Collaborations like never before, that's great. And I think inside our professional lives and our personal lives, we have seen new friendships forged. We have seen heroes emerge. And I think that, now we can step back and say, we took some things for granted, like being able to be with family and friends. And I hope that we take those lessons learned and that it just creates a gratitude within each and every one of us that we not only use in our personal lives, but we bring it back to our professional lives to serve people better in new ways, in reimagined ways. So that's what I think will come out of this as well.
Yeah, I never thought I'd miss seeing my coworkers so much, so can't wait to get back to those days. Dr. Arnold, anything, kind of on a positive note you'd like to share to end?
Yeah, I think that there are a few things. I mean, number one, the amount of attention paid to the disparities in healthcare, the social determinants of health. We've been talking about it, knowing about it for so long, but to see it really brought to light in a way that people, I think, have an energy like never before to sustain ongoing efforts and try to mend a lot of wounds. I think that's wonderful. I think that there's also been a lot of trust inside of generosity towards finding solutions and creating solutions for the community, and that came from either private donors or came from nonprofits, and all of that I think was really helpful in giving people the liberty to have the fuel they needed to drive solutions in a way I'd never seen before. And then lastly, inside the healthcare field, the communication, the partnerships, the dedication to service, the service over self was at its utmost high, the highest I have seen it since I began to train, in which really some of the silos were deconstructed and people were just rolling up their sleeves, pitching in for the sake of the patient in a way that we always do, but was really special this time and unique and encouraging. I hope it moves forward.
I can't even imagine the work and the things y'all have done on the front lines. So thank you so much for that. And it's sitting back, at a bird's eye view, I know y'all are working so hard and people don't get to see that, right? So just thank you. And Ray, just to wrap it up, anything good that you see coming from this crisis?
Well, the first thing, I can't let this discussion end without saluting the Hamilton County Health Department. They've literally worked 7 days a week and many days around the clock to help our community respond to this. And public health has been underfunded and sometimes under-recognized in past years. So I hope that this will raise the profile and awareness to the importance of public health. There's so many things that they do absolutely every day to protect us as a community and us as individuals. And so I just have to salute them for the work that they've done. And then just reinforcing what Dr. Willis and Dr. Arnold said, the community collaboration, the awareness of health disparities, working together in the fastest speed I've ever seen to really build new partnerships, to find some solutions. To me, that is really extraordinarily encouraging. You know, they talk about the Chattanooga Way, and sometimes the Chattanooga Ways involve long periods of study. Well, the Chattanooga Way now was sort of on steroids as we very quickly had to mobilize a lot of people who don't always work together. So I think we've torn down some silos. I think we built some new partnerships. I think we found some really wonderful ways to communicate and to address health disparities. And so I think that can only help us create a healthier and more productive and happier community as we go forward. And so I think it's been one of the toughest things I think everybody in healthcare has ever done. And finally, I just have to salute the frontline healthcare workers, the doctors, the nurses, the staff assistants, the people who've been out doing the testing, standing under too much PPE in the blazing heat and working around the clock to make our community safe. So as somebody who's not a medical professional but gets to work for them, I'm just honored to be part of that because they really have literally put their lives on the line for the good of the community. And to me, that's an extraordinary gift that healthcare community has given to the larger community.
Well, thank you for all that. And thank you, everyone, for just sharing your insight and participating and taking time out of your incredibly busy schedule to talk with the Times Free Press. And we just look forward telling the stories that go forward from here. So thanks, everyone, for tuning in, and we'll sign off.
Goodbye.